Hello, my name is Tom Safford. I'm an associate professor in the sociology department at UNH and a faculty fellow at the Carsey School.
I'm Larry Hamilton. I'm a professor in sociology and a senior fellow at the Carsey School of Public Policy.
Okay, so this morning we're here to talk a little bit about a brief that we just completed that's entitled Views of a Fast Moving Pandemic, a survey of Granite Staters' views about responses to COVID 19. And this is a piece of research that came together very fast, just like the pandemic. We were thinking about the importance of social science and sociologists understanding how residents of New Hampshire are thinking about the COVID 19 pandemic, how they're responding. And so this was a really important piece of research, both for residents of the state, but also for policymakers that are thinking about how can we communicate different kinds of information. Our survey happened in the early parts of March, so we were looking at a time before the stay-at-home order was issued by Governor Sununu, and really thinking about how the diverse kinds of messages that residents were getting from politicians as well as news sources might be affecting how they are behaving or how they're thinking about the pandemic.
Yes, and as Tom says, this was put together very quickly in terms of a survey. It was conceptualized, the survey was run, and we analyzed the data all in March. But the roots are really quite deep. Both Tom and I have been doing research for many years on public perceptions and awareness about science, and how those sometimes, unfortunately, are filtered by political outlooks. I started doing work on public opinion, public knowledge about climate change more than 10 years ago. And by about 5 years ago, was really noticing how the political rejection of climate science was overlapping into political rejection of other things, science about vaccines, for example. Tom has long had research interests in Brazil, and he became interested in the Zika virus. So we did a paper back in 2016 about public perceptions of and public trust in science information regarding the Zika virus pandemic of 2015-2016.
Okay, so just to get started, we wanted to share with you some of our the broadest findings that are in figure one of our brief. And these show the overall views of people in New Hampshire about both President Trump's response to the coronavirus pandemic, as well as Governor Sununu's. And one of the things that you can see really quickly looking at this data is, in the case of President Trump's response, there are very polarized views, with a more than 50%, 56% either somewhat or strongly disapproving of his response, and then about 40% either somewhat or strongly approving, and very few people in the middle. So this really does mirror a lot of the polarization that we're seeing sort of in the policy context well beyond the coronavirus, but you can see even at this time in early March, this kind of fragmentation. And the bottom of that figure, you see the similar question that asked about Governor Sununu's response, and you can see that there's a much more positive view of his response, with 67% saying either they somewhat or strongly approve. And this is a period of time before he issued his stay-at-home order on March 26th. And so I think, again, you don't see quite as polarized a view. And this may also be the degree to which Governor Sununu was out in the public versus President Trump in terms of thinking about that. There's more folks in the middle on the neither okay on Governor Sununu's response. So I think this is interesting. There's a very big difference in the way that the public here in New Hampshire is thinking about President Trump's response versus Governor Sununu's.
And I'll add to that, if people can keep in mind what that top figure looks like with the very polarized response, 56% disapprove strongly or somewhat of how Trump was handling the crisis, and 40% strongly or somewhat approve. And there's sort of a hollowed out middle ground with only 4% of our respondents. Just keep in mind that picture because a few graphs later, we're going to show you how that seems to be affecting the way individual people change their own behavior in response to the coronavirus, the COVID-19 pandemic. The polarization gets echoed there.
Okay, so we looked at this general response, and then the next thing we were really interested in is just the overall confidence in the government. So I think that this is one of those, again, one of those issues that Larry and I have both been thinking about, this sort of erosion of even trust or confidence in the government over time on a number of policy issues. And so if you look at the next figure in our brief, it talks about this overall confidence, and you can see that there's a large percentage, almost two-thirds, that are either only somewhat or not very or not at all confident in the government's ability to respond. So this is again another thing. There's a lot. It seems to reflect the public's sort of uncertainty, and they're really looking for messaging from politicians as well as the media to sort of help them understand what's going on. Where can they get information? Do they believe that public officials have the ability to actually effectively respond? And this suggests, at least in early to mid March, that people are really concerned that our government would have the ability to effectively respond.
Yeah, and that concern's well placed. We now know that the federal government was getting warnings as early as the first week of January about what was to come, and that there was something like 7 weeks were lost before it began to take the issue seriously. So this, as Tom was pointing out, the lukewarm to no confidence you see here somewhat tracks public events as well.
Okay, so the next thing we were really interested in, ultimately, one of the things that was out there, even at this early page, and even back into February, was that the scientific community was already talking about the need for social distancing, the need for individuals to change their behavior. This was really the scientific message, where we saw at that same time that President Trump and the Trump administration was more emphasizing restrictions on travel and the transmission of the disease from people coming into the country from other places or travelers. So we were really interested in this time, while the scientific community was really out in front saying we need to change our behavior, we need to reduce social interaction, social distancing, versus the sort of other message that was out there from the federal government. Were people actually changing their daily behavior voluntarily? Because this is a time we were surveying before the stay-at-home order. So if we look at the next graph, I'm sorry, we can go to just one more graph here. The next one. So here's an example where we see that at the time of our survey, we found that, optimistically for me at least, that the majority of people in New Hampshire, 77%, said they were making major daily changes to their routine, going out less, hopefully practicing social distancing. But the other issue is that there was this significant percentage, almost a quarter of the people either were making no change at all or only minor changes, such as washing their hands. And so while certainly it's good that 77% of the people said they were making major changes voluntarily, we know from the scientific community that really, to be effective, we need almost complete compliance with these kinds of behavioral changes. And so this led us to say, well, who is it, or why might people be making major changes or not major changes in their routine? And I think that one of the things we were looking at is, how is maybe scientific information out there, and the most important kind of source of scientific information on this topic, which is the U.S. Centers for Disease Control, the CDC. How are people thinking about that? And so maybe if we go back a slide, and Larry can talk a little bit about the CDC, since they're so important in this. Maybe go back a slide if we can. There you go. Talk a little bit about the CDC as a key piece of information. This is something he and I have been interested in studying over time, this sort of trust in science agencies.
Yes, and I'll also say that for people watching this, that you'll want to see the published brief. You can download this. It's either online or download it free from the Carsey School, and go back and look at all these figures so you can see the details. We're going past pretty quickly here. So the Centers for Disease Control is the CDC is the premier U.S. agency that is you would expect to be able to respond to this crisis. Now, over the last few years, they've suffered a number of budget cuts. They've been downgraded in terms of their access to the administration. Nevertheless, this is whom Americans would look to for a competent science-based response to an emerging pandemic. And our survey found very high percentage, 77%, said that they did trust the CDC for information on coronavirus. Notice that that's quite a bit more than, quite a bit higher percentage than the fraction who thought the federal government was responding effectively. And that highlights the fact that right now the government and the scientists are two different things. I mean, they could be the same. This is a government agency, and yet now the administration's response has very often been at odds with the scientific messaging.
Okay, so again, maybe we can go ahead 2 slides here and get to, I think, what's really the most important findings that we can share with people. And I think in our brief, you can read more about this. Is we wanted to understand, who's changing behavior and who's not changing, or why might some people be more likely to be changing their behavior or not likely to change their behavior, because we need this entire society, entire Granite State kind of approach to this problem. And so what you see here in this graphic from our brief is that we find there is a statistically significant relationship between those who strongly support President Trump's response are less likely to have made those major changes, such as changing their daily routine, leaving home, those kinds of things, than folks that either strongly or somewhat disapprove of his response. So we see this sort of suggests that the messaging that he is providing at this time, there was mixed messaging that was less about what the scientists say and maybe more other factors, as I said, like travel and maybe economic factors that were more a part of his discussion of this, that there is a relationship between those things, which is really important. And the second slide looks at Governor Sununu's approval based on, linking that with leaving home less often due to the coronavirus. And we didn't find any relationship with that. So again, it isn't, there isn't that strong correlation or that relationship between approval of Trump in the case of Governor Sununu.
Yeah, so this graph will be the first of two we show you that's putting together two earlier graphs. Is putting the top panel is putting together the Trump approval with the percentage who say they're making major changes, such as not leaving home, which I'd emphasize at this point, at the time we did the survey, was still a voluntary thing. The New Hampshire's Governor Sununu had not yet issued his stay-at-home order. But what you're seeing is that the political divisions we saw way back in the first slide are translated into behavioral differences on actually a matter of life and death. It's not too strong to say that. So in New Hampshire, I might add that the voluntary compliance, even before the official stay-at-home order, the voluntary compliance in New Hampshire was probably a lot higher than it was in some other states, judging from polls we've seen elsewhere. So New Hampshireites were a little bit more cognizant of this, regardless of their political leanings. Nevertheless, you see a substantial gap there in whether people are listening to the scientists based on their political orientation.
Let's go to the next slide. I was actually going to let Larry start off on the next slide. I think this is a really important one. He's done a lot of research thinking about this political dimension. The importance of the media is so critical at this time. We're all on our televisions or on the internet trying to get information. And so we really wanted to understand how this kind of, this sort of polarization of what kinds of media sources certain individuals look to more than others. So I'm gonna let him talk about this. This is really he's an expert on this particular topic. So I'm gonna let him go on this particular slide.
Yeah, okay. I mentioned earlier on that I've been doing research on public knowledge and perceptions about climate change and other science topics for many years, and we noticed the huge importance of Fox News in particular as an information source for people who were rejecting the science on climate change. And so it was a sort of a natural thing to to check here whether that was impacting behavior during the pandemic. And by this evidence, and actually there have been a number of other studies already in other states, it certainly is that during the weeks of this survey, the general tone on Fox News was very scornful about the seriousness of the pandemic and whether people uh, should make behavioral changes in response, and maybe this was just a political ploy against the President Trump. So how that's reflected here in the surveys is quite a gap between people who say they watch Fox News every day and people who say they never or only occasionally do. Quite a gap in terms of their daily behavior during a pandemic that is, over this time, you'll see what it was doing in New Hampshire and the nation. It was coming on very, very fast, but the news media was to some extent shaping people's perceptions of that.
Okay, so I think that those are our key findings. One of the things that we maybe just end on is we still know, looking at the kind of final graphic in our brief, that there is this sort of continuing trend line upwards of the number of cases, obviously in the nation, but also in New Hampshire. And so for me, as I'm thinking about the importance of what we found, is we really need all media outlets, all political figures, all of us as scientists, social scientists, medical scientists, really focusing on a collective approach, and that we are going to need uh, everybody to be talking about the importance of social distancing. It can't just be some segments of the public or other segments of the public. And I think that's going to be really important. And one of the other things Larry mentioned early on in our earlier research, we've looked at this kind of erosion of trust in science, or people questioning scientists' integrity, that science is being produced just for some political business kind of end. And I think that in this time of a public health crisis where we need to be very carefully following the science, we need public figures and media outlets of all types, of all ideological bents, talking about scientists are trustworthy people. Scientists have a critical social role to play in informing the general public about these issues. We need to understand their perspective, what's the truth and what's not the truth, and rather than kind of blowing with the sort of the political or the ideological wind of the day, we need to sort of step back from that and have this sort of consensual approach to thinking about, how are we all going to get through this crisis? We need everybody to be social distancing. We need everybody to be practicing these behaviors, because we're only going to be safe if we have this sort of collective response. So I think that's the big takeaway I would like to have viewers or people who are reading our brief thinking about, is that this isn't an ideological issue whether we're going to get COVID-19 or not. This is an issue that affects everybody, young, old, people of every ideological bent. And so that's really what I want people to take away from our work.
Okay, maybe if we could show, there was one last slide in the PowerPoint. Maybe we show that. That's in the brief, and that brings us up to where we are today. So should be one more. There we go. And the survey that you just saw results from was run from March 17th through March 26th. And at the end of that, right at the end of that time, on March 26th, Governor Sununu issued a stay-at-home order. So all those things that you saw about people actually staying at home, they were doing that before it was official state policy. What this graph shows, the blue dots track the number of cases in New Hampshire, starting at 0 back in early March, and it's well over 600 today. And the dashed red line shows the number of cases in the U.S., starting in low numbers and now well past 300,000 and heading up. And you can see how steeply it's climbing. The whole idea of stay-at-home orders, of sheltering in place, is not to end this epidemic. It can't do that, but to slow the increase. To flatten the curve. You'll hear people talking about that. Although, of course, a flat curve just means level, staying the same level of infection, and in any event, the point of the stay-at-home orders is to try and slow the speed of contagion here, speed of growth of the epidemic. So this sort of gives you the context where we were during the time the survey was conducted, where we are now. You'll see that cases in New Hampshire, for example, continue to climb very steeply for a couple of weeks after the stay-at-home order. That's what they do. Even if the order is hugely effective, you wouldn't see any decrease in new cases for several weeks, and you wouldn't see any decrease in deaths for a time longer than that. So we're watching to see what happens, but this is the big picture where we are today, and why it is that scientists remain very concerned, medical people remain very concerned, people on the front lines everywhere. The political discourse does not always work with these numbers, and maybe thinking of different things. So anyway, that's all in the brief, and this graph is updated through data through yesterday, so it's about as new as we could get. You want to wrap it up, Tom?
Okay, so I think we're at the end here. So I encourage everybody to take a look at our brief. Our contact information is on there. We certainly want to get feedback, or we want people to be engaging with our research and findings. And so we appreciate you watching this afternoon, and love to hear feedback about anything that we've discussed in our little media video outlet here.
Okay, goodbye.